Hello and welcome to Anatomy and Beyond's dissection of the leg. Today we're going to be looking at innervation of the lower limb. That includes the leg and the foot and the thigh. We are also going to be looking at an overview of the sacral plexus. But for more detail on the sacral plexus, please view our other video. I will include a link to that video in the description box below. I'm using software from Complete Anatomy 3D. I highly recommend this software. It's online. This video is in no way sponsored by them. This is something that I've used throughout my teaching career, and I have also used it for my own learning purposes. I will also include a non-affiliated link to Complete Anatomy 3D in the description box below. First of all, I apologise if this video is a bit clunky. It is purely down to my editing skills and not the software. So here we have the right leg in the anatomical position. I'll just move this image around now so we can see the back and the medial, lateral and anterior sides of the leg. I can also rotate this leg so we can look at the foot. But for now, I will return to the anatomical position because that is where our interests lie. So what I'm going to do now is I'm just going to zoom in on the lumbosacral plexus. Here we are looking at the lumbosacral plexus from an anterior and slightly medial perspective. Here we have the psoas minor muscle, and here we have the psoas major muscle. We also have this important piece of anatomy down here, which I'm going to highlight in green. This is the inguinal ligament. I'm just going to remove psoas minor and psoas major now so we can see the lumbosacral plexus in its entirety. I'm just going to move the model around now, and we're going to look for our first branch of the lumbosacral plexus, which is the iliohypogastric nerve. As I zoom in here, I can highlight this nerve in pink. This is the iliohypogastric nerve. This nerve has two main branches. It has the lateral cutaneous branch of the iliohypogastric. This innervates the skin to the lateral gluteal region, highlighted in purple now. And I'm also about to highlight the anterior cutaneous branch of the iliohypogastric, which innervates the skin of the hypogastric region. You can see where that follows by following the purple nerve right now. I'm just going to hide the anterior cutaneous branch of the iliohypogastric, and I'm also going to go back and hide the lateral cutaneous branch of the iliohypogastric to keep our diagram nice and clear. Finally, I'll remove the rest of the iliohypogastric, and we can move on to the next nerve. We can move on to the ilioinguinal nerve now, which is this nerve highlighted in pink. I'll zoom out so you can get a better perspective. This nerve runs along the inguinal canal towards the genital region, where it supplies sensory innervation to the scrotum and the root of the penis in males, and the mons pubis and the labia majoris in females. It also gives off motor innervation branches to the internal abdominal obliques. I'll just get rid of that now so we can move on again. Our next nerve of interest is the genitofemoral nerve. This nerve travels down the front, so the anterior portion of psoas major. I'll highlight that in purple now. This is another major nerve of the lumbosacral plexus that has two main branches. It has a genital branch and it has a femoral branch. The first one we are going to look at is the genital branch, which is this nerve right here. This nerve travels within the inguinal canal and supplies motor innervation to the cremaster muscle within the scrotum, and supplies sensory innervation to the anterior scrotum and to the skin of the mons pubis and labia majora in females. We also have the femoral branch of the genitofemoral nerve highlighted now. This innervates the skin at the anterior upper part of the thigh. And as we can see from the image, it travels deep to the inguinal canal. I'm just going to get rid of those two nerves now, so that we can tidy up our diagram even more. I'm also going to get rid of the genitofemoral nerve. So now that our image has been tidied up even more, we're now going to focus on the lateral cutaneous nerve of the thigh, or the lateral femoral cutaneous nerve. As I zoom the image out, we can see that this nerve travels deep to the inguinal ligament, but superficially to the quads of the thigh, down the lateral aspect of the leg, and innervates the skin on the lateral thigh. It also innervates the skin of the anterior and posterior thigh as far down as the knee. I'll just get rid of this nerve now. So now we can return to our lumbosacral plexus on the search for our next nerve, which is this nerve that I'm going to highlight in pink. This is the femoral nerve. This nerve travels deep to the inguinal canal and fits within the space of the femoral triangle, as we can see from here. Because of its location within the femoral triangle, this nerve is susceptible to damage during venous catheterization in heart procedures. But for now, let's concentrate on its roles. So it has two major roles. One of these roles is to supply the skin on the anterior and the medial surface of the thigh. This travels superficial to the sartorius muscle, which we can see highlighted in yellow. Now the nerve is highlighted in pink. And if I zoom out, we can see just how far this nerve travels. So it travels down to the level of the knee. To be specific, this sensory nerve is called the anterior cutaneous femoral nerve. I will now remove this to tidy up the image and look for the deeper nerves. If we zoom in, we can also see that the femoral nerve has muscular branches. These are highlighted in purple. But we can also see that we have this other nerve, which I'm about to highlight in purple, which is the saphenous nerve. I've just jumped back slightly, and now I'm going to remove the sartorius so we can see the full extent of the branches of the femoral nerve. Firstly, these purple branches are the muscular branches. These muscular branches supply the iliacus, the pectineus, sartorius, and the quadriceps muscles. I'll just remove rectus femoris right now so we can see the extent of these branches. So here we can see the vastus medialis, lateralis, and intermedius that are supplied by the muscular branches of the femoral nerve. Highlighted in pink, down we go. And if we have a look over here, I will highlight the vastus medialis muscle in yellow. And here is the vastus intermedius, highlighted in yellow now. And finally, the vastus lateralis. These muscles are important collectively for extending the leg at the knee joint. Now, as I zoom in on this model, I will remove the muscular branches of the femoral nerve so we can get a better picture of the remaining nerves. The final branch of the femoral nerve that we are interested in is the saphenous nerve. This nerve travels deep to the vastus medialis muscle, but anterior to the adductor longus muscle. Just get rid of vastus medialis now. And there we can see the course of the nerve as it runs down the leg. As I just move the model now, we can see the patella for landmarking purposes. As we can see, the saphenous nerve continues its course down the medial anterior aspect of the leg into the medial aspect of the foot, supplying the skin sensation as it courses and produces numerous branches. A few of these branches can be seen given off from the saphenous nerve around the knee area. I'm now going to move the model so we're looking at a more medial aspect of the knee. I will now highlight the infrapatellar branch of the saphenous, which innervates the skin around the medial aspect of the knee. I'll get rid of that. There we go. And these are the medial crural branches, which innervate the skin over the medial aspect of the leg, which again, I shall move the model around so we can see the full extent of these nerves. Before getting rid of them so we can concentrate on more nerves. So what I'm going to do is just zoom back in and highlight the saphenous in pink. as you can see, and zoom back out just to remind ourselves that it's travelling down the medial aspect of the tibia and into the medial aspect of the foot, where it's supplying the sensation of the skin all the way down this aspect. Just use the landmarks to orientate yourself, and then I'll remove this nerve so we can move on to the next nerve in our lumbosacral plexus. I'll just orientate ourselves, and I will add the muscles back in for the greater picture after I've deleted the femoral nerve, of course. There we go. So now I have added the muscles back into our pelvis and our lower limb. I'm going to highlight this nerve here. This is the obturator nerve. This is the next nerve in our lumbosacral plexus. That is not, but I will get rid of the psoas muscle, both major and minor, so we can concentrate on the obturator nerve. So as I zoom in, I'll pick out the obturator nerve again in pink. Now this has a particular special path. It has its own canal, the obturator canal. So this canal is formed through the obturator internus and the obturator membrane, where the obturator nerve evacuates through this hole and into the femoral region. This muscle here is the pectineus muscle, and I'll remove that so we can see what is going on. So now what I will do is I will re-highlight the obturator nerve, and we can see that there are a few branches coming off this nerve that supply slightly different regions. First of all, we have this nerve, which I'm about to highlight now. This is the anterior branch of the obturator nerve. This nerve is supplying the adductor muscles, so the adductor longus, gracilis, the adductor brevis, and the pectineus muscles. It also provides sensory innervation to the medial skin on the thigh and the hip joint. If I just remove those muscles that are in the way, we can see its course as it travels to supply the adductors of the thigh. This long muscle down the right hand side of the screen, so the medial aspect of the screen, is the gracilis. So there we can see the obturator nerve supplying the gracilis muscle. I will just zoom in now so that I can remove the anterior branch of the obturator, and we can look at the posterior branch of the obturator, which I shall now highlight in purple. The posterior branch supplies the obturator externus muscle and the adductor brevis muscle, and also part of the adductor magnus. So we can see here its course again as it's innervating those muscles. So I'll remove vastus medialis, and I'll also remove the muscle in yellow, which is the adductor brevis muscle. So we can see now the actual course of the posterior branch of the obturator nerve as it's travelling down the leg. So it exits the medial compartment of the thigh, the adductor compartment of the thigh, through the adductor hiatus and enters the popliteal region, where it provides sensory innervation to the knee joint. I will just zoom in on that now so you can see where it is terminating. If I just remove the medial head of the gastrocnemius, we will be able to see where the posterior branch of the obturator terminates within the knee joint. Just zooming in now, and there we go, highlighted in purple. So that concludes the course of the posterior branch of the obturator nerve. If I just kind of reset the image a little bit, then we can get rid of that branch and concentrate on the rest of the nerves. I'm now just going to reset the muscles around the lower limb, and then I will remove the psoas muscles, so we can continue looking at the course of the rest of the nerves within the sacral plexus. So the nerve that I've just highlighted in pink now is the lumbosacral trunk. And what we will determine in a short while is that this forms part of the sciatic nerve, but we also have some other branches coming from it. The first one we're going to look at is the superior gluteal nerve. This is this one highlighted. If I just zoom out a little bit and then rotate the model around so we can see the posterior aspect, we can see the gluteus maximus muscle, this large band of muscle that is forming across in yellow now. And if I remove that, we should be able to see the superior gluteal muscle. This exits the pelvis from the greater sciatic foramen and innervates this yellow muscle here and the muscle below, which is the gluteus minimus and gluteus medius muscles. Here in purple again we can see the superior gluteal nerve. There it is, coming from L4, L5 and S1, and I'll just remove that now. There is also a small nerve underneath that we can see that is left over. This is the nerve to the piriformis muscle. Again, I'm just going to remove that now so that our picture is nice and clear. Okay, so let's move on and look at this nerve. This is the inferior gluteal nerve. If I just zoom the image out and follow its course, we can see that deep to, again, this large muscle, the gluteus maximus muscle, we can see that the inferior gluteal nerve, which I'm going to bring up in purple any second now, innervates the gluteus maximus muscle from the deep aspect. So now I'm just going to tidy up the image once again. So what I'll do now is I'll just rotate the image once again so we can see the lumbosacral plexus from the anterior perspective, and I'll add the muscles back in for the purposes of clarity. So now we are going to look at this absolute monster of a nerve, which is the sciatic nerve. It's got two portions, which we'll discuss in greater detail in a second. But for now, let's rotate the model around so that we can see where this nerve is travelling. So let's follow its course down the posterior compartment of the thigh. I'm going to remove some muscles first, so let's remove gluteus maximus. And we can see that the sciatic nerve is exiting below the piriformis muscle and through the greater sciatic foramen, where it's given off branches along the way. This one here is nerve to the quadratus femoris muscle. That's coming directly off the lumbosacral trunk. Let's just get rid of that one. So in the meantime, let's also just remind ourselves of some of the hamstring muscles. The first muscle we're going to look at in yellow is the long head of the biceps femoris muscle. We also have this one, which is the semitendinosus muscle, running down the posterior aspect of the thigh. I'm just going to remove both of those muscles now so that we can see the course of the sciatic nerve. And there we go. Okay, so the sciatic nerve, running down the posterior aspect of the thigh as previously discussed. Along the way we have these branches here. These are the muscular branches that innervate the hamstring muscles, so that's the semitendinosus, membranosus, biceps femoris, and the hamstring portion of the adductor magnus. So let us get rid of those now and we can concentrate on further nerves. So the sciatic nerve is made up of the tibial component and the common peroneal component. This portion highlighted in pink now is the tibial portion. But we also have this other portion, which I'm going to highlight in pink, which is the common peroneal portion. We're going to take a more in-depth look at this nerve first. Okay, so I've just snapped the image around, so we're looking at a lateral aspect of the leg. So this is down the outside of the leg. where we can see we've got several branches from the common peroneal nerve. We have this one here, lateral sural cutaneous nerve, which innervates the skin of the lateral, posterior and anterior proximal leg, so that's the proximal calf region. And as we zoom in, we can also see this sural communicating branch, which picks up fibres from the medial cutaneous sural nerve and forms this nerve here, which is the sural nerve. It travels to the distal end of the leg and into the lateral aspect of the foot, where it gives off, which is the lateral dorsal cutaneous nerve of the foot, and this other nerve highlighted now in purple, which is the lateral calcaneal branch of the sural nerve. Together these nerves supply the skin on the plantar and lateral portions of the heel and foot. Okay, so let's climb back up the leg and get rid of a few of these nerves. We can say goodbye to the sural nerve, and we can climb back up the leg and remove the sural communicating branch of the common fibular nerve, the common peroneal nerve. There we go. Okay, so we are now back to this nerve. This is the common fibular nerve, and we can see that this is travelling deep to the fibularis longus muscle. But just zoom out for your own perspective and orientation. There we go. Now if I just get rid of that muscle, we can follow its course and see the branches that it gives off. Okay, so we have the common fibular nerve, and then we also have some branches. I'm just moving it around slightly so we can see these branches here. Okay, this nerve, this is the recurrent articular branch, which supplies the knee joint and the proximal tibiofibular joints. We also have two other branches coming off. What I'd like to do first though is just reorientate ourselves slightly and remove some more muscles so we can see what is going on. So we're going to look at these muscles in the anterior compartment of the leg. First of all, we have extensor digitorum longus, so let's get rid of that one. And the anterior tibialis, or tibialis anterior, so let's get rid of that one and we can see what is going on. The first one, as already discussed, is the recurrent articular branch. Whoops, screwing off the image there. Supplying the knee and the proximal tibiofibular joint. Get rid of that. We also have some more branches here. So we have this one, which is the deep peroneal nerve, or the deep fibular nerve, travelling the full course of the anterior compartment of the leg and into the dorsal aspect of the foot. These are then going to branch within the foot. I'm going to try and highlight these now in purple to form the dorsal digital nerves of the foot that supply sensation to the dorsum aspect of the foot, so the skin of the foot on the dorsal aspect and the toes. So I'm just going to get rid of those nerves now to tidy up our image. So what I also forgot to include on the way down of the leg was the muscular branches of the deep fibular nerve. And we can just see a couple of those here. These supply the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and fibularis tertius muscles. Okay, let's have a further look. We're getting there now, not too many to go. So back at the knee again, and back to the common peroneal nerve. And we also have a superficial branch of the common peroneal nerve. And this descends in the lateral compartment of the leg and penetrates the deep fascia to enter the dorsum of the foot, which will be evident in a second. So we have the superficial branch here. I'm just rotating it more so we can see a slight more anterior perspective, and we can see that it's given off branches on the way down as it descends into the foot here, where it branches into the medial and lateral dorsal cutaneous nerve of the foot, which collectively form the dorsal digital nerves, again supplying the dorsum aspect of the foot. Again, we have some more branches here, some muscular branches. These supply fibularis longus and brevis muscles. So that concludes the common peroneal nerve, common fibular nerve. So we can now get rid of that and move on to the tibial portion of the sciatic nerve. There we go. Just a reminder of its course, and then we can get rid of it. Okay, so the tibial portion of the sciatic nerve, not quite as complicated, thankfully. I'm just going to replace the musculature. So again, we get the full flavour for what is going on. And we can zoom in on the popliteal region where we will see the tibial portion of the sciatic nerve. Just going to get rid of this long head of the biceps femoris. So again, we can see underneath. I also want to get rid of the medial head of the gastrocnemius muscle. And I'm going to get rid of the plantaris muscle again. These that form the boundaries of the popliteal fossa. And now everything is exposed for a little while. Okay, so the tibial portion. Oops, everything's shooting off camera. The tibial portion of the sciatic nerve we can see coursing through the popliteal fossa and into the posterior compartment of the leg. This is the popliteus muscle, and the tibial nerve is travelling superficial to that, and between the heads of the soleus muscle. Within the popliteal fossa, if I just zoom in on this now, we can see that there's some muscular branches given off. There we go, in pink. These are supplying the muscles within the posterior compartment of the leg. So let's move on now to the other nerve that is of great interest, branching off within the popliteal fossa. This is the medial sural-cutaneous nerve. So this is supplying fibres along with the communicating sural nerve to produce the sural nerve, in this case for the right leg. There we go, highlighted in pink. Let's get rid of all of those now because we don't need those anymore. And so we can zoom back out. Remember, we're looking at the posterior aspect of the leg. And we can continue the course of the tibial nerve within the posterior compartment of the leg, the lower leg. Just get rid of gastrocnemius, the lateral portion, and we'll get rid of the soleus and the calcanean tendon in a second. Okay, so this fascia highlighted is the transverse intermuscular septum of the leg, and we can see that the tibial nerve is penetrating this to supply the deep posterior muscles, the muscles within the deep compartment. So as we continue the journey of the tibial portion, we're going to get rid of this calcanean tendon here because this is in the way. So let's get rid of that and follow the tibial nerve down into the plantar aspect of the foot. Now here we can see we've got some more branches given off. We can see this one here, the medial calcaneal nerve, which is supplying skin to the medial aspect of the heel. We'll get rid of that and we'll move on to the next interesting branch. This is the lateral plantar nerve, This is travelling deep within the dorsum aspect of the foot from the medial side and supplies motor innervation to all the muscles in the sole of the foot, except for those innervated by the medial plantar nerve. It also provides sensory innervation to the lateral plantar skin and toes. Oops, apologies, we're shooting all over the place. Give me 1 second. This is the only part where this software gets a little bit difficult, is when we are trying to look at the medial, the dorsum, the plantar aspect of the foot. Okay, so there we go. Back again. Right, we'll get rid of that nerve now as well, and we'll move on to this one. This is the medial plantar nerve, which innervates the hallucis, the abductor hallucis, flexor hallucis brevis, flexor digitorum brevis, and the first lumbrical muscles. It also provides sensory innervation to the skin of the medial plantar surface of the foot and the first 4 digits. This is done by the proper plantar digital branches of the medial plantar and the common plantar digital branches of the medial plantar. We're just going to get rid of those. So they're the common ones, and the proper ones are the ones right at the distal end of the toes. So we could get rid of those now. Okay, there we go. So what I'm going to do now is just continue to remove the rest of the tibial nerve, because that concludes the journey of the tibial nerve. So let's move on, and I will reset our model back to the anatomical position. And snap. There we go, back to the anatomical position. Nearly there now. Not much further to go. Okay, so after the sciatic nerve, when we go back to the lumbosacral plexus, we are going to look at the next important nerve. So as you can see, I have reinstated all of the muscles except for the psoas muscles. I'm going to look at this nerve here. This nerve is the posterior cutaneous nerve. As I move the model around so we can have a look at the posterior aspect, because this is the posterior cutaneous, you can see it appearing just below the gluteus maximus and travelling down the posterior aspect of the thigh where it innervates the skin. I'll zoom out now, you can see the full extent of it. It travels just below the popliteal fossa, innervating the skin to the posterior thigh. I'm also going to remove the gluteus maximus muscle, so we can see a couple of branches that are given off. So I've just highlighted again the posterior cutaneous nerve, and now I'm going to highlight the nerve that innervates the skin of the gluteal region. This is the inferior gluteal cutaneous nerve. So let's remove that one as well. Okay, nearly there. And we can also remove the posterior cutaneous nerve. There we go, we can see the extent of it going on there. Let's get rid of that. 2 nerves to go. We've got the purple one that I'm about to bring up now. This is the perforating cutaneous nerve. This pierces the sacrotuberous ligament and then innervates the skin over the inferior aspect of the buttocks. Final nerve, I'm just going to get rid of this one first. And zooming in on the final nerve of the day, this is the nerve to the obturator internus. This nerve does exactly what it says on the tin and innervates the obturator internus muscle. Okay, so congratulations if you've got this far. You have been listening to Tanya from Anatomy and Beyond. If you found this video useful, give me a like, hit the subscribe button, and I will get some more Anatomy Made Easy videos to you as soon as possible. I look forward to seeing you in the next tutorial. In the meantime, good luck with your revision, good luck with your practicing,